My name is Peter Zhao. I am a registered acupuncturist based in Calgary, Alberta. I will be one of your hosts for today. The first speaker is Dr.黄国健. He is an acupuncturist and traditional Chinese medicine doctor with training from Nanjing University and Peking Union Medical College. He has worked at the China Friendship Clinical Medicine Research Institute in Beijing, as well as many other institutes in both China and Canada. He is currently practicing at his clinic, Ankang Acupuncture Healing Center in Winnipeg, Canada. Dr. Huang is specialized in Mini Ren Acupuncture therapy, acupoint catgut and bedding therapy, Fu's subcutaneous needling for pain management, and treatment of infertility, as well as other various common and difficult diseases. He is currently the president of the Alliance of Acupuncture and Chinese Medicine of Canada and holds positions in numerous other TCM organizations around the world. Dr. Huang's presentation today is on Mini Ren Acupuncture therapy and its effectiveness in treating peripheral nerve entrapment syndrome. Please fill out the Google form to ensure that you are signed into this presentation. We will hold a question and answer period after the presentation. Dr. Huang, go on ahead.
Okay, thank you. Thank you, Peter. Thank you, Dr. Zhao. And so I'm so excited today to have a chance to have my presentation about the Mini Ren Acupuncture treatment for the nerve entrapment syndrome. And I'm so happy today because before you lots of you guys maybe know that we hold each year maybe two international conference of acupuncture and Chinese medicine. This year we only have one that international conferences in that end of May. So, and then from this year, from our analysis of acupuncture and Chinese medicine of Canada, we will arrange more continuing education program. So, today is our first time. Today is our first time, that for continuing education program from in March, and also we have next few in the June, September, and December. So you guys welcome, to pay attention to our update information for our continuing education in 2023. And also, you're welcome to attend our 2023 international conferences of acupuncture and Chinese medicine in the May 28th. Okay, so let me start my presentation today. Okay, I think that Peter has introduced me already that for my education background and also my practicing experiences in China and also that in Canada, so that I don't want to say too much and just go next one. And I just want to introduce that also I has been awarded as the top 10 best doctor, from World Federation of Internal Medicine 2022, I'm honored to be the 10 best doctor award. Here is my clinic in Winnipeg. I want to know a little bit about my practice background. Typically that my clinic, so this is my my clinic outside and inside waiting room and my herb store there. And also that my clinic has been, honored as the top 3 best acupuncture clinic in Winnipeg 2023. And also I'm the #1 of 27 acupuncture therapists in Winnipeg from Red MDs. So that I'm very proud of myself, that to be honored like those kind of awards, from my patients. So, and here that also, and I would like to introduce that I have 2 books has been published in China. One book is talk about, the single Chinese herb medicine, that the clinical application is this one. And also that this book talk about, that the single acupuncture points, at clinic application. And this all that have, that the case studies, to introduce each point, how to use that, how to, to manipulate and how to get the best result. And here I'm also honored to be the visiting professor from the University of East-West Medicine of the United States. Okay. And here also I used to, attend before the pandemic, we went to Vancouver, Toronto, and San Francisco, attend international conferences of acupuncture and Chinese medicine. Okay, so let me start, today's topic about the mini Zen acupuncture treatment for nerve entrapment syndrome. Okay, so before that talk about this topic, I really want to share my experience when in my last 20 years practicing in Canada. Before I'm studying or using mini Zen acupuncture therapy, most of my difficult case in my clinic is that if the patient complain, they have some nodule pain, on the body. Typically, when patient point out, hey doctor, this is the pain I have. It's a kind of big nodules, on the point. That time I don't know how to treat it because with my regular acupuncture needles, cupping, massage, none of them, works for those kind of nodule, the tenderness, nodule pain. Second most challenge to me is that if the patient complain, the tingling and numbness on the hands or on the legs or any part of the body, that make me kind of headache. I really don't know how to treat those kind of patients because that from my textbook, from the medical school, typically from Chinese medicine part, when we talk about tingling and numbness, we always think about because tingling because of the lack of the blood flow, is that that's why it causes that the tingling.
Oh, hi.
And if patient have the numbness on the hands or feet, from Chinese medicine we always believe that maybe some flame and damp blocked meridians and then cause that the lost sense of the feeling, that causes numbness. But since I using mini Zen acupuncture therapist, and I found those issues is not any more big issues to me, because that most of the time I can find a way, at least I know how to make diagnosis, how to assess, how to find the treatment targets, and how to achieve the best result. So before that, lots of you guys, maybe I'm talking about lots of use mini Zen acupuncture treatment for the pain issues. So today I would like to share my experience and to introduce how to use mini Zen acupuncture to treat those kind of nerve entrapment syndrome, which patient most of the time has pain combined with maybe tingling, numbness, on the hands, on the foot, maybe on the back, on the body. So that is most of the challenge I know to most of acupuncture therapists. Of course, today that after the presentation, I will leave maybe around 10-15 minutes to answer your questions. Okay, so that okay, let me start. First of all, I would like to talk about that our nerve system, that in our human body, the nerve system, including the spinal cord, is the most important signaling system. So if that area where the nerve fibers pass through is compressed, it can lead to the nerve impingement syndrome. The symptoms of the nerve impingement syndrome vary, depends on the situation, and the individual. They can be very mild, maybe just temporary, or maybe very severe. So also it could be short-term or could be long time exist there. So only diagnosis and appropriate treatment, it is very important. It can help the patient to get earlier recovery. Of course, in some cases, for example, from car accident, from sports injuries, okay, from very severe accident, so nerve damage caused by impingement may not be able to fully heal, but the symptoms can still be relieved through that treatment, and including that pain and numbness. With my treatment, the patient can get better as soon as possible. So let me talk about the reasons why that the nerve can be compressed or that entrapped. Most of the time, most common reasons is that repetitive motion injury or maintaining the posture for a long time can lead to two possibilities. For example, first one, we all have this kind of experience, I believe, because of when we long time sitting on the toilet, to read some book, the novel, or some plays at the cell phone, for example, 30 minutes or 1 hour, and after that we get up, you will feel.
他还留在 Gym 里了，他说不知道是谁。
You will feel that the whole legs numbness. It is hard for you to stand up and to walk forward. So that is very common. I mean that we do have this kind of experiences. And also sometimes patients complain that during sleeping, they have tingling and numbness of the hands or arms, because during sleeping, they bend the arms for hours. That's why it causes tingling and numbness. So this kind of issues, most of the time, it is temporary and not the big issues, because after you walk around and when the blood flow getting, better, and then this tingling and numbness condition will getting better. But another cases, I mean that in clinic, we'll see some patients have long-term repetitive, motion can cause soft tissue damage around the nerve tissues. Like this kind of issues could be, I say, from accident, sports injuries, okay? So that is very common. And also some people, maybe just because of their job, they have frequently repetitively using, most of those muscles, that then can cause that the soft tissue could inflamed and then could swelling. So when it's got swelling, it will increase the peripheral pressure, on the surrounding the nerve tissues or blood vessels. For example, that for cervical spondylosis patient who maybe work in the computer for a long time and have been looking down at their phones for a long time, or patients with a carpal tunnel syndrome, they may experience numbness and pain, due to the compression of the median nerves. So this is kind of, condition we need to treat. Okay, so this is kind of, that in my clinic, we will see those kind of patients. So the reason is because when there are some tissues that protect, even though we know that our nerve fibers, we have some tissues protected as they pass through the human body. But generally, they are still very susceptible, to get injured, especially when they passes through the narrow areas. For example, the median nerve is tightly wrapped within the carpal tunnel in the wrist. When any soft tissue within the carpal tunnel is damaged, and then inflammation and swelling occur, it can compress the median nerve. So this is kind of very common issue. So next we talk about compressed sites. Just I say, when nerve pass through the body, the most commonly compressed areas of the neural tissue are where they pass through the ligament, the tendons, or the bony tissues, or at the entry or exit points of the muscles, we call the gateways. So those parts, it is very easy, very susceptible, to get injured or get, that from this point. So these areas are where soft tissue injuries are mostly likely to occur, where inflammatory scar tissue is mostly easily formed. For scar tissues, I will talk about after that, okay? And also, where the nerve entrapment syndrome are mostly likely to occur on these areas. So there are also the preferred treatment sites of mini Zen needles. For example, inflammation or compression of the spinal nerve roots, the spinal cord nerve, can cause neck pain, low back pain, even radiating or referral pain to the arms or to the lower leg or ankle. So those kind of compression can cause multiple symptoms, not just pain, but tingling and numbness, and also just localized. It can cause it also can cause the refer the pain or tingling or numbness. Okay, so from that, the videos show that that the scar adhesion tissues inside of the muscle. So that part of muscle, it lost the functions because the muscles, we know that when that work, it should have a contract and extend the functions. In case of scar tissues or adhesion inside of the muscle, and those pieces of the muscle, will lost the function, and will make the muscle kind of first of all weakless, and then painful, and then it will show the nodules there. So that's why that we say when the scar and adhesion tissue formed, actually you can find in the injured areas, it has some kind of nodules or hard high tension in that area. Okay, so actually that the clinic, lots of chronic pain, lots of chronic issues, tingling, numbness. It is kind of scar adhesion tissue related. For example, here, that from here, area found to be scarred down the compressed of this early nerves, found to be that, this glass compressed, discolored for about 1.5 centimeter from this part. And this from a, cubital, the tenor, because early nerves, pass through the tenor. If this, tenor has been inflamed and scar tissue formed, it will cause patients complain, that the baby, that the penny finger, all this, that the ring finger, these areas could tingling numbness. Okay, so that's the one. And here we talk about the muscle strain injuries. When the muscles get injured from the trauma, from accident, when that, before, for example, from these pictures here, that the muscle fibers look very organized, that the blood vessels, the vein, the nerve, that pass through very, that managed. But once get injured and then get swollen and then get inflamed, so they will change the shape because tension inside is different. It's not balanced. So the tight part will pull the blood vessels, the nerves to that side. Okay, and then when finally the scar tissue form, and then the nerves, you can see this nerve, this blood vessel or the arteries, the vein were compressed in scar tissues. So when this happened, and with our so far the treatment, we don't have very effective treatment for that part. because of the right now we just use regular acupuncture needles, the massage, the physiotherapy, the chiropractor. None of that, worked for the scar tissues, except the doctor give you surgery. But we'll talk about the surgery after that. Here, also scar tissue around the nerve root. If that happens in your spine, if it's in your spine, spinal cord, or spine areas, the nerve, that the nerve root could be compressed by the scar tissues around here. So it is quite common. I say that some conditions maybe we need surgery to fix that, but most of the time in our that outpatient clinic, in our acupuncture clinic, we'll see more compression conditions, most probably like this kind of conditions or like this kind of conditions. So with mini Zen acupuncture, it is perfect, to work on those kind of situation. Okay, so that the next I would like maybe to introduce what kind of symptoms, in case the nerve has been, entrapped by the scar adhesion tissues or by the swollen inflammation, the soft tissues. What kind of symptoms could it be? First of all, pain. Lots of patients come, for the pain treatment. Typically, some patients will come for sciatic nerve pain, right? They come, complain, doctor, I have a pain, on my buttock, and then on side, behind the knee, calf, maybe down to the heel or down to the ankles, right? But with this patient, some patient may also combine with numbness. Say, oh, doctor, when I'm just standing on this leg, after 5 minutes, my whole legs got numbed. That is very uncomfortable. So, and then they have to move around, and then sitting or lying on tables, take a break, and then that condition may be getting worse, getting better. But when start to stand up to walk again, and then that the symptoms and the pain will come back again. So that is problem. And also could be, I said, localized. The pain or numbness is present only in specific areas where the nerve is being compressed. For example, the leg pain or low back pain, or maybe we say the carpal tunnel, the syndrome. Patients maybe just that feel the tingling and the pain on the wrist. This kind of local pain. Some patients have some radiating pain, referral pain. I say just like the sciatica or some other radiating pain. This can extend from the low back to the buttocks and down to the ankle. Okay, so that could be that radiated. And also some patients tell you different stories. Some patients just complain the feeling like pins and needles. Some patients tell you completely numbness. From the Western medicine, seems no big difference. Anyway, this all kind of nerve entrapment syndromes and problems. The nerve has been compressed from that, that scar tissues all swollen around the nerve areas. But anyway, from Chinese medicine, we say that difference, right? Pins and needles, like tingling, just like because lack of the blood supplies. And numbness could be that the flame and damp, that accumulated in that infected areas. And also some patients have that tingling and burning sensation on the skin. So that is kind of like trigeminal, pain on the face, like the cutting, the burning sensation on the face. And of course, with the nerve entrapment syndrome, if the muscle has been impacted, and then the patient may feel kind of weak of those kind of muscle. When they do some movement, they feel not strong enough as usual. And I say, and this kind of impaired function of the limb, with pain, numbness become more noticeable or worsening during the certain activities. So generally, those kind of condition, those kind of symptoms, that represent the nerve entrapment syndromes. here, we just do maybe talk a little bit about the differences of the tingling and numbness. I say it from Western medicine, they don't have any differences generally, all because of the nerve has been compressed. But in China, as a clinical, that practitioners, we all know that we have the word. We say pain, maybe that is mild, not just mean mild, maybe easy to treat. Once patient tell you tingling, pins on needles, we'll say this condition is the more serious. And then if patient tell you totally numbness, that could be very serious of this kind of condition, of this disease. So from very mild, maybe easy to get treated, and then to very serious, that means the treatment is very difficult. So this kind of experiences shows that the treatment of nerve entrapment is a challenge in both the Chinese medicine and Western medicine. We'll say tingling refers to a decrease in the sensitivity of the both sensory and motor nerves after nerve compression, while the numbness is a state of the partial loss of sensation caused by relative ischemia, I mean that the lack of the blood supply of the nerves, accompanying that vessel compressions. So of course, the numbness is a bit more serious than tingling. But of course, I mean, most of the time, it is kind of challenge, for treatment of this kind of nerve entrapment in the traditional medicine. So let me talk about right now that the treatment for Western medicine part. Typically, Western medicine medical treatment for the nerve impairment syndrome maybe include first of all rest. Okay, so because adequate rest is very important for the newly developed nerve impingement syndrome, because our body needs time, needs rest for the healing process. For serious cases, we did a further examination, to identify and address possible causes, such as scar tissue applications, disc herniations, or bone disease. Okay, so today that I want maybe emphasize, that one point is that we talk about this kind of tingling numbness is caused by soft tissue injuries, not from that like diabetes patient, because the nerve has been, that damaged from that this disease. Okay, so there's totally different stories. And the conventional treatment for from Western medicine, you be to see the family doctors, they maybe give you some kind of anti-inflammatory drugs. I mean, that's non-steroid, okay, like aspirins, or give you some oral, maybe that corticosteroids, some kind of steroid, and also kind of painkillers. Maybe they also give some in the injection, that the cortisone injection. And from physiotherapy, most of the time they tell you maybe you need to stretch exercise. Okay, maybe do some kind of strengthening exercise too. But if those, that the solution doesn't work, the last options, maybe we have to get the surgery. But surgery, of course, it has lots of, that potential side effects for most of the nerve impingement, that syndrome. So here's comments. First of all, we say both, from Chinese medicine and Western medicine, we all need, emphasize the need for the rest or less exercise. And then meanwhile, take some kind of anti-inflammatory drugs to control inflammation and edema, and also take some painkillers. Okay, so many relying on the body's own healing ability, waiting for time to repair or to heal. So from this point, I say from physical therapy, I don't think that the strengthening exercise or stretch exercise is good for those conditions, because whatever stretching or strengthening exercise, it will irritate or aggressive the injured areas and cause more inflammation, more that the swelling, and maybe can make the condition worse. So I don't agree with strengthening or stretch exercise from the physiotherapy. And of course, if that the drugs doesn't work, physiotherapy doesn't work, maybe that surgery is last choice so far for most of the time from Western medicine, right? But for the surgery, it also has some kind of risk behind, like that you have to use that anesthesia drugs during surgery, maybe cause lots of bleedings, and also it can cause secondary, scarring from the surgery. So that is going to be another issue. After surgeries, patients can, that develop more problems. So far I say, doesn't work very well. Here we talk about, mini Zen acupuncture therapy. This is it's my part, because that's why today I'd like to share, my experience, my understanding, why this is, the best solution for that nerve entrapment syndrome from soft tissue injuries. Okay, so mini Zen acupuncture. Mini Zen, I want to explain the Zen. Zen means one kind of the blade from Chinese word, Zen. Okay, it has kind of a sharp blade. Mini, that means very tiny. Okay, so we call mini Zen acupuncture therapy is developed on the tiny blade needle. Target superficial fascia, the nodules, muscle spasm, scar tissue, adhesion, and myofascial trickle points. It is very effective, revolutionary therapy to treat various of soft tissue injury pains, nerve compression and dysfunction, etc. So by dissection of the mini Zen needle, it is very effective to relieve compression and inflammation on the nerve fibers. Okay. Okay, so here that I show the pictures, that show the differences of the needles. Okay, here that is our regular acupuncture needles, like 120. Okay, it's a sharp, the end of circle, the sharp on top. But with the mini Zen needles, it has a tiny, the blade on top of needle. So it's like the life, or we can say, or the blade. So that's the differences. Otherwise, they all look the same, just on top, a little bit different. And also this may be a nip, that 0.35 millimeter of this needle, size. Here, maybe the regular needles may be more fine, more thin, maybe just 0.22, 0.25, 0.30. But from a mini Zen, that the smallest size is 0.35. So that's a little bit bigger than the regular acupuncture needles. Okay. So here, when we perform or use mini Zen acupuncture to that nerve entrapment syndrome, what you can find, what you will feel, on the treatment areas. Okay, so this, I guess, maybe lots of you guys want to know. How do you use that? From my own experiences, I found once the surrounding nerve tissue is compressed due to soft tissue damages, the common symptoms usually include the pain, numbness, and muscle weakness. That means when you examine the nerve entrapment syndrome, there's often the tenderness, the tense skin or muscles at the nerve exit point, and there may be obvious nodules present. So that when you use the fingers or hands to pipette, that areas, and then you will feel that areas, the skin is harder, the soft tissue is harder than the surround, that normal tissues. And also, when you press it, the patient feel pain, the tenderness is there. So that's very easy, you can identify here if it is a treatment areas from迷你刃 acupuncture, because these areas totally the texture of the soft tissue is totally different from the normal soft tissue textures. Okay, and this tense skin and muscles and the nodules with obvious tenderness are the pathological change of the nerve entrapment. So meanwhile, it also indicates that the presence of invisible, that septic inflammation at the site of the entrapment. So it could be a little bit, swollen, a little bit harder, but this inflammation is that, no bacteria inflammation, okay? And also the numbness symptoms of this nerve entrapment can be, exacerbated or alleviated by different movement, but the tenderness at the site of entrapment is always there. So that's why give us clue, okay? When we know which nerve has been, compressed, we can find the place where it's harder, where it's tender, where is swollen, and then where is our treatment target. So here,迷你刃acupuncture therapy for nerve entrapment syndrome. The principle is that use迷你刃acupuncture therapy to release scar tissues adhesion or relieve pressure on surrounding nerves by trigger points in the fascia or the muscle tissue, eliminate inflammation, improve the blood circulation, and restore nerve function. Just like what I said, the treatment method is based on the cause of the defective nerve and the location of the patient's clinical symptoms. Locate and treat the painful nodules causing that compress. So that's the very simple way. Okay, I think I missed the one that the advantages and features of迷你刃acupuncture therapy. I think I'm, that missed one slide, but doesn't matter. But anyways, you may ask, hey, if you use the迷你刃acupuncture, it's very safe. How to use that? What's the features and advantages of the迷你刃acupuncture? Okay, first of all, I say the needle size is very small. If you look at, that the real the needles exactly the same as 1/10 acupuncture needle. Okay, every time when I show that needles to my patient in my clinic, they don't know the differences because they look very similar. Second one is that, the treatment is very superficial. We don't have to go to very deep. Typically that on those kind of nerve entrapment part, we just go to maybe 0.5 centimeter or 1 centimeter or 2 centimeters maximum, because those kind of compressed sites always very superficial. So we don't have to go to very deep. Second, the third one is that the treatment is very safe. I say it is very superficial, right? And also the treatment itself, the pain is very, very minimal. Most of patients can tolerate. You don't have to take any painkiller during the treatment. And also, the advantages is that we treat the target. This target is scar tissues or the trigger points. It is not on the blood vessels. It is not on the nerve. So it is very safe. Okay, and then next one, it is very accurate treatment. because when we find the problems from patients, that the movement limitation, and then we can find effective muscles, the fascia, and then we know when we palpate it, we know the hard part, hard texture of the of skin or soft tissue. We know that's the problem there. So I say the treatment targets or sites include all kinds of the nodules. This nodule could be very tender, or maybe not very tender. But of course, you will feel it's hard. The texture is hard. Maybe if the blood vessel has been compressed, also the local skin temperature is kind of low. When you palpate, when you put the fingers on top of the skin, you feel kind of cold. If you compare to that, surrounding the soft tissue or skin, you can tell the differences right away. And of course, the treatment, the effect is immediate, because when you find the problem, when you find the cause of that nerve entrapment, once you remove this cause of the entrapment, and then of course patient will tell you right away, oh, my tingling getting better right away, or my tingling getting, that disappeared right away. So it is kind of miracle.
Okay, Dr. Wang, Dr.
Yes.
Huang, it's 15 minutes. Do you think we need some break? 10 minutes, and then we carry on?
Sure, that you want, that take a break, it's fine. Sure.
And the doctor wants 15 minutes introduce the mini regions, acupuncture, anatomy, physiology, pathology, very useful, knowledgeable information for registered acupuncturists, because for the acupuncturists, the training mostly for the points, meridians, right? We need more information about the pathology and the physiology for the different problems. Anyway, so we have a 10 minutes break, if you're okay. Everybody okay?
Okay, sure, sounds great. Thank you.
Yeah, and we come back on time. So
Sure.
right now, so 2 o'clock we start again.
Yeah, after that, I have more the treatment videos maybe want to share with you guys. So I would like you
Yes.
guys come back and then look at what I treat my patients. Okay?
Yes.
Yeah,
Yes.
we'll see you later.
And also I remind every audience to mute your phone, because if somebody talking, so I don't know who's talking, will interfere the speaker's lecture. Please mute your phone, please. Okay, thank you.这个会长讲得很好，我觉得你可能要我觉得讲得很不错哈。然后你看看大家可能是不是更关注临床一些，然后呢，对，然后呢，
后面就基本上都治疗东西了，
对治疗的东西，然后讲一讲这个 case 这些东西。这是我个人的意见了哈。我觉得讲的挺好。现在呢，就是说大家呢听了听之后呢，看看。其中有一个听众说，这个能不能会后需要你的这个记录，就是 video record， 就是那种录像，这些东西我要跟你沟通一下，你是否可以，还是我们有什么要求？
可以，到时候我们可以放到网上面，然后让他们自己看就可以。
OK， 好。还有就是说，在讨论，还在50分钟，然后就讨论。讨论的时候呢，我们再提醒一下大家，需要学分的话，你需要就是要 sign 的力，是吧？签到一下。
是，可能大概今天我时间会长一点点，不一定exactly 2 hours。所以如果长一点，
没关系，因为我们2个小时以后还是有时间的，还有
2个小时呢，对，所以我们可以。
但是呢，
没关系。
但是就是说你掌握一下节奏，就是说我们是50分钟之后，是不是要提问题？
请你看着你提醒我一下吧。
就是说50分钟以后我们再提问题，提问题完了， 然后呢，你需要继续讲的话呢，还可以继续讲，还是说你一直讲完了的时候我们再提问题？
我讲完以后再提问题吧。
然后就是说你大概预计是在50分钟不够，再加10分钟、20分钟。
我估计20分钟左右，可能是因为我需要就是说解释一下，不能光放哈。我估计大概20分钟多一点。
对，这样那我让 Peter 说一下 ，OK， 或者是我说一下 ，OK。目前有什么问题没有？
No, so far so good to me.
你这个要不要喝点水休息休息？
我这有水。
OK，good，
我这有咖啡有水。
OK， 要不要去个厕所？因为讲起来是挺紧的，时间
还听得还清楚吧？
还可以的，对你这个字幕
很好，
这个字幕好。
OK， 是，行，听得清楚就好。现在
错，
我上洗手间。
你是既是老手又是高手，又讲的非常细致，非常到位。所以说能获奖也是这个名副其实的。OK，
这个就是虚荣啊。行，我去上洗手间，等会过来。
会长有一个问题是你看到了哈 ，MR 就是迷你认知会不会伤神经哈？就是这个，你看这个 WeChat 的话，你不见得现在回答了，就是说到时候你讲完了之后哈，WeChat 这个 chat 里面，
那票看好了，等会那个之所以会一起回答吧他们的问题。
一起回答就是你这个问题，我觉得可能是首要的问题，也是大家最关心的问题哈。
是。
So, Peter? So, okay, so I think we start again, resume this lecture seminar. And we finish the 15 minutes, the first part. In the second part, the speaker, Dr. Huang, I think maybe take more than 15 minutes, maybe around 70 minutes, okay? After the 70 minutes, he will answer the questions. You can type your questions in the chat, okay? And when he finishes the lecture, he will answer all the questions. Thank you. And I think today is very good. I think it's a lot of audience. It's very good. Okay, so let's start, Dr. Huang. Yeah.
Okay, thanks, Dr. Zhao. Okay, and let me continue. And before that break, that I talk about number 8, that the result, the treatment effect is immediate. That so that's why lots of patients say, "Oh, doctor, you're a miracle." That doctors, "Oh my gosh, I feel that getting better right away." So you will get lots of that the pride from on my patients. So that's very, very good. And also that the benefit or features of this kind of therapy is the diagnosis and the treatment, are all objective, and also they all have very good repetitive repeatability. That they can repeat. Result no problems at all. And also after right now I have lots of students learned from me that learn this mini acupuncture, and of course they all can do the same that the treatment as I do. And also that the miracle things is that with the treatment under your fingertips, once you use the needles to break up those kind of nodules, and then when you under the fingertip, you notice the nodule become smaller or flat. You will tell the patient is getting better. Before patients tell you, and then you already know patients will be getting better. So that is very good thing because the treatment progress is very clear in your heart. And also that the next one, next advantage is that most important is this medicine acupuncture therapy is very simple, objective, and scientific. So there's no need to learn any metaphysical theories like I Ching, Ba Gua, in 5 elements, to figure out which meridians, which points, which organ cause the problems. No, you don't need to do that. It's directly everything under your fingertips, under your eyes. So that's why I have the idea. I say the pain is visible. It's visible, and also you can feel that. Okay, so we'll talk about in the future. So here, I just claim that the medicine, the blood needle, is the most powerful weapon for releasing scar adhesions. Okay, here that we, the scar tissue we all know is a product of self-healing by the body after injury. So scar tissue is the fibroactive tissue that is tough and lack of elasticity, making it difficult for the body to digest and absorb quickly. So that's why I say that some scar tissues could be lifelong, exist in your body. Okay, when at a certain point, a part of this soft tissue becomes adhered, so muscles and other soft tissue cannot freely stretch or slide, in the body, so resulting in loss of dynamic balance in the body and leading to physiological dysfunction. At the same time, it can pull and compress nerves, causing pain, numbness, swelling, and other symptoms. So scar adhesions can also block circulation channels, leading to the local muscle atrophy and swelling. In the case of large scar adhesions, some muscles and ligaments may be compressed, thickened, shortened, hardened, and less elastic, resulting in physical deformities. So we can see lots of patients in the clinic, happen in this way. Ordinary that acupuncture needles, we say, only can penetrate the scar tissues, but cannot cut open or cut through it. Only that the blade needle can cut through the scar adhesions of the collective tissues, relieve the compression, traction, friction on other soft tissues, eliminate pain, numbness, and improve the blood supply. Okay, here that I made a small video to explain the difference of the regular needle and the blade needle, to treat or the scar tissues.
Today, I would like to present how to use our mini zinc acupuncture needle to break up scar tissue. These two file gun represent normal muscles. These wraps represent the skin and normal soft tissues. In normal physiological conditions, they should move very smoothly up and down, back and forth. But in case the muscle got injured and then scar tissue formed, this muscle movement will be interrupted. For example, we have a string here. Just represent the scar tissues between, because there are no any elastic fibers between, so it's hard to move them. And then how to break up the scar tissues, because in our acupuncture clinic, most of the time we only use this regular acupuncture needles. Of course, we can try to break up, but most of the time we can go through, but it can't to break up. But if you use mini zinc acupuncture needle, and then it is very easy to break up, because it has that very sharp blade on top of the needles. We can directly to cut it.
So you can hear the cutting sound.
Yeah, and then the scar tissue will break up directly, and then the muscle movement will back to normal. So that's the differences from mini zinc acupuncture needle and the regular acupuncture needle for scar tissues. Thanks for your watching. Today I
Okay, so that from those kind of videos, we just want to, to show that the difference of the blade needle and the regular needles, the effect on the scar tissue. So they are totally different. Okay, and of course, I also say the mini zinc acupuncture needle is best choice for the activating the myofascial trigger points, and it is better than dry needle therapy. Because here today we talk about the more that is for that, that nerve entrapment syndrome. But pain is also one of the symptoms. So for the pain, that could be caused by the trigger points. So myofascial trigger point is a painful or tender nodule that can cause local tension, just like scar tissue. There are many inflammatory pain factors inside the myofascial trigger points that stimulate nerve fibers endings cause the pain. So, and also it has whole microcirculation inside myofascial trigger points, and also can cause local tissue necrosis. So mini zinc acupuncture therapy can directly cut open the nodule, reduce the internal pressure, and release inflammatory pain substances, which is more effective than dry needling. Because dry needling still just regular needle that pass through the nodules. That's it. It can cut or break up the nodules. It can directly improve the local microcirculation, promote the local tissue healing, and directly eliminate scar tissue around the nodule, relieving the taut band spasm and the compression it puts on the surrounding the tissues. So that's why that I use medicine needles instead of regular needles for the pain treatment. Works, that are very good. Okay, so that before that I talked about that the series about the medicine acupuncture, scar tissues, trigger point, nerve entrapment syndromes, blah blah blah. So next part, I would like maybe introduce how do I use medicine acupuncture treatment, applications of the medicine acupuncture needles for entrapment nerve syndrome, okay, ENS. First of all, case, that I would like to introduce that the medicine acupuncture needles for great occipital neural migraine headache. This is patient, I treated that 2 years ago. So she was a lady, 60 years old. She has suffered, from the vascular neurogenic headaches over decades. And since 2016, he has had regular attacks that have gradually become more frequent, aggressive. During this period, he has sought treatment from all kinds of specialists, alternative therapies, but with no success. She came to my clinic for treatment in March 2019. When she came to my clinic, I noticed that she had a chronic illness appearance with frown, tiredness, and severe headaches, mainly in the forehead, top of head, and back of the head. She also had neck shoulder tension, muscle stiffness, photophobia, nausea, vomiting, difficulty standing, and a pale tongue with thin white coating. And the varicose veins, is kind of double plus with a thin and weak pulse. Examination, I found the neck muscle was very tense, and the first cervical transverse process was protruding on the right side, and with various tenderness, very sensitive. The great occipital nerve and the lesser occipital nerve had enlarged the painful nodules at this point of the neck under that inferior the notcher line. There was also tenderness with pressure around the cervical vertebra 2 to 7, as well as painful nodule at the start and end points of the sternocleidomastoid mastoid muscle, trapezius muscles, and the serratus anterior muscle. The patient also had tenderness with pressure on the Baihui acupoints on the head. So treatment, I put the patient, and with medicine acupuncture needle to loosen up the enlarged the painful nodules and tapping therapy. The treatment only 10 minutes. Immediate result. The patient, reported after treatment, he had a significant relief of the pain and improved vision, and was able to walk home independently. So this patient, I told her that give around 15 sessions the treatment. The patient has not experienced any recurrence of the vascular neurogenic headache since then. So right now, over 4 years now. Her migraine headache, no comeback. Occasionally just have some kind of headache. Here, her name is Lucy. Okay, so that time she gave me that chart from 2016 until 2019, come to see me. The red part is kind of migraine headache, and the blue is kind of headache. So from there, it's getting worse and worse and worse. And also, she can predict when that migraine headache will occur, when that headache will occur. And every month, only maybe half month is in the normal stage, and half month in the pain. So after my treatment, the pain completely gone. and has been, I say, cured. Here, that's the, that the videos I share how do I treat the patient. So you say that your migraine, how long has been that migraine, that on off?
14, 15 years.
14, 15 years. Okay, so right now that during the menopause, it is even getting worse, right?
Yes.
Yeah, okay.
Yeah.
Yes, all tenders, right?
Yes.
Yes. So first of all, I use my both hands, that on both sides, and then to check up the tension of the muscles, soft tissues, and the scope, the line, the base of the scope, and then to find any kind of tender or hard nodules around there, and also sliding on skin and soft tissues to find trigger points or scar tissues above that spine aside along the spine, and then all the muscles too. If I find them, use that, and it works right away. Okay, so this is a great occipital nerves. Okay, so from here, it come from that that the sleep tube, and then go through on the back of that the muscles, and then go up to that your head. Okay, so next one. So that susceptible the compression side of the greater occipital nerves. Usually that happens. I mean, the common side of the entrapment of the great occipital nerve, it emerges from the fascia between the obliquus capitis inferior muscle and the semi-spinalis capitis muscle. Okay, and also that it appears through the trapezius muscle. So that's both sides. It is very, that it's very common compressed side. And also when you use a hand, just sliding all that to pat these areas, you will find that always have some kind of hard, tender nodule there. So examination, there is a tender nodule at the site of nerve entrapment. Treatment, the patient is placed in the prone, the position with the chin tucked in, with the chin close to the chest, okay, and the neck extended. So a mini Zen needle is used to longitudinally incise the nodule and release any adhesions causing nerve entrapment. So once needle put inside, and then you can hear sounds like cutting sounds, like crunching sounds. So some people say that the chatting needles, whatever. Side effects generally, if it work properly, and there should be no any side effect because we only, I say, target on those kind of nodules, okay, not on nerve, not on that blood vessels. And also that I use a mini Zen acupuncture treatment to treat the lesser occipital nerves, that the neuralgia and the pain is different. So that, yeah, this is the video. What can I help you today, man?
Oh, I got some tingling sensation in my side of the head and above the ear and the hairline. So
When
I
did it
feel like
happen?
it's falling asleep.
When did it happen? When did the first time happen?
It started the first and second week in June.
In June.
Yeah.
Okay, so that is almost 1 month
Over a
now.
month. But I had come down with COVID, said I couldn't come in.
Yes,
And then we had a wedding and we had company from BC, so
yes.
it's been busy.
So right now that happens very frequently, or just once in a while?
Every day I get it.
When to turn side?
Yeah, if I'm sitting here for a while like this and I hold it down,
Yeah.
then it starts to tingle.
Where's tingle exactly tingles?
It'll tingle through here,
Okay.
up in the hairline. It feels like something's crawling under the skin.
From skin, yeah?
Yeah, like right in here right now I can feel it.
Oh, okay.
It feels like a mosquito is bitten, it's itchy and you always want to scratch it, but I know I
Okay.
shouldn't. And
Okay.
right there, it's tender.
Good tender here, right?
Yeah.
Yes, good. Oh yeah?
Yeah,
Tender too, right? Oh yeah?
that's not so much
Okay,
there.
good. Yeah, and continue to this me.
Can I hear?
No.
No? No, eh?
No.
No, okay, good. So I believe that he's suffering from what we call nasal occipital nerve entrapment, because the nasal occipital nerves come from here and they radiate to these areas. So I think that from this area, after treatment, and then he should be better for that. Yeah, from here. Okay, so then that I'm like maybe that lie on the bed. Right? To the right?
I can move it in the head.
Yeah. Sit on here again. Okay, sit there. To move the head again to see how we feel now.
It takes a while for it to start in.
Yeah, so.
I don't feel anything yet.
You don't feel anything yet, right? So that's great. So usually how long when you hold this position, you will stop here?
Well, sometimes it takes not even 30 seconds.
Seconds, that's seconds, eh?
Like sometimes if I'm doing something in the kitchen,
Yeah,
making something to eat or something, I got my head down, I already start and I can feel it.
okay, but so far you don't
So
feel
far I
it.
don't feel it, but
That's great. So then anyway, that if you feel that, I guess maybe
so when I'll get a question for you. When you were working here,
yeah,
it felt like you were scratching the bone. I
Yeah.
could hear it in my head, like
yes, you can
Yeah.
hear that, yes.
how come?
Yeah, that's
It's just the nerves.
just music things.
Music.
Yeah, music things, yeah. Yeah, magic. Yeah, I said magic. Okay, so
Okay.
yeah, so you can come back again if you need any help, okay?
Okay. Thank you.
Okay, so this patient that actually she's my patient over maybe 5 years. Every time anything happen, that he will come to my clinic right away. But actually this time that when I treat his at nasal occipital neuralgia pain after the treatment, and then the pain never come back. It's almost 2 years now. So when you find the right place, get the right treatment, you will get the right result, and also immediate and long-term result. So that is very good, that the technique for this kind of nerve entrapment syndrome. Okay, next, let me go down next.
What can happen?
Okay, so here that maybe we talk a little bit about nasal occipital neuralgia. So this disease is very common in the adults and the characterized by the nasal occipital neuralgia as the main symptoms. The pain is the paroxysmal and can be described as a stabbing or cutting sensations, and may even relate to the forehead and eye sockets. Head movement and coughing can trigger the pain, just like what he said. When he turned head, you feel pain right away, just like electric. And during the attack of moment, there may be a dull pain, the neck muscle spasms, and the head may be held in a rigid position, hold the head, scared to move. So examination from immunizing acupuncture therapy, the tender nodules are present at the compressed point of the nerve, just like you say, you saw that on the video. When I just press there, you feel, it's very tender. The nodule is there. The treatment is very easy. Just put the patient in the place in the prone or lateral position with the chin touching the chest and the neck extended. The medicine needles is used to longitudinally incise the nodules and release the compression. That's it. And usually the treatment takes 3 to 5 minutes will be done. So next case, I would like maybe introduce that cervical nerve entrapment by postoperative lymphoma. This is a young man around 40 years old. That I saw him maybe 5 years ago. He was a postoperative, for right neck lymphoma, complaints of leg, back, and shoulder pain for 2 years, accompanied by numbness and pain in the shoulder and upper limb. He has consulted many specialists without success and believed that it was due to scar tissue adhesions. after post-operative, that the radiotherapy, and could not be treated. So he had to adapt to these symptoms in his daily life. Because his wife, was in my clinic at that time for pain, headache, and then he said, okay, I'm going to try that treatment. So that's why he came to my clinic and to try my treatment. The time examination showed that there's the large scar tissues on the right side of the neck, back, and armpit with tenderness. The neck and the back muscles are tense. There's tenderness around the spinal process of C6 to C7, T1 to T3, with enlarged tendon nodules. There's also some spasm pain in the back muscles. Treatment: medicine acupuncture needles are used to release the enlarged tendon nodules in the neck, back, and the infragenoid, the tubercles. Treatment time is 5 minutes. Immediate effect: the neck and the back pain improved significantly. The muscles relaxed, and the numbness in the arm was relieved on the spot. The patient felt it was unbelievable and the neck very helpless. Long-term result: after 5 session treatment, all patient symptoms disappeared. Pain, the tingles, and numbness all disappeared. So 2 years later, the patient come back, for treatment for the back pain, and reported that after the treatment, the numbness in arm had never come back since then. So that's the way that I say with medicine leaders to relieve, the nerve entrapment syndrome. It's very effective. Here that I show you that, that cervical, that the vertebral, that the nerves, that from C1 to C7, and then that it has all different kind of, situations. Here that maybe just quickly that, to summarize the cervical spondylosis, tingling, and numbness. You can tell which part has been compressed. Okay, for example, from the intervertebral space of C1 to C2 vertebra has become smaller, causing dizziness and headache. The treatment points is painful nodule located 1.5 centimeter beside the midline of the neck In cases the nerve has been compressed in between C2 and C3, intervertebral foramen has become deformed and smaller and cause the back pain and numbness. So the treatment point is a painful nodule structure located at the edge of that spinal process of C2 and C3. If that C3 and C4 intervertebral foramen has become deformed and smaller, it can cause neck and back pain with numbness. So that the pain moves down from local, gradually downwards, and then radiate to the arm. But when that that C4 to C5 intervertebral foramen has become deformed and smaller, causing neck pain, back pain, and pain in the upper arm below the elbow. So the treatment point is that the painful nodule structure located at the edge of the C4 to C5 spinal process syndrome, spinal process. Because beside, you can feel the tension, the scar tissue there, the nodule there. And of course, if that the compress happens between C5 to 6 intervertebral foramen, and then that can cause leg pain, arm pain, numbness in the thumb, index fingers, and the middle fingers. Okay, the treatment point is a painful nodule located at the edge of C5 to C6 spinal process. So you can find it. And then when you release those kind of, the painful nodule, and then those tingles, numbness will be getting better. Of course, in case that, that the compress between C6 to C7 intervertebral foramen, then it can cause neck pain, arm pain, numbness in the ring fingers, okay? And then middle finger and the needle finger. So the treatment point is painful, the nodules beside C6 to 7 spinal process. So it is very simple, to memorize, that in case the slow road has been compressed between that the intervertebral, that the disc, and then it can cause the tingling and pain, numbness, from neck to shoulder to arm to fingers. Okay. Okay, so this is the that the education videos talk about cubicle that tendon syndrome. Actually, that is very common. That in clinic, lots of patients complain the ulnar nerve is compressed because from there that regular sports injuries or that that kind of long-term work on the one kind of movement, Okay, so here the patient I want to introduce that, that is a male patient, 42 years old, who has complained the neck and back pain for 10 years, accompanied by numbness in his right upper limb and weakness in his thumb. He has history of multiple leg injuries from the car accident. He has sought treatment from various pain specialists, chiropractors, massage therapists, and physical therapists, but with poor results. Examinations that revealed tension in the leg muscles, including that cladiomastoid trapezius, capillaris, biceps, triceps, and pectoralis major and pectoralis minor. There was tenderness at the origin of the wrist extensor muscle and elbow, and many enlarged painful lodges along the course of the radial nerve leading to the thumb. Treatment involved using that mini zinc acupuncture needle to release the painful nodules in the neck, back, and the forearm. The treatment lasts around 7 minutes. The result that after treatment, the patient felt relief in his neck and back and noticeable improvement in the numbness in his arm and back of his thumb. And the long-term effect after 5 session treatment, the leg and back pain disappeared and did the numbness in his arm and fingers. So after 5 sessions, all condition getting better because basically his condition caused from the car accident. Here, that I just want to show you that the cause of that from arms that we have 3 nerves, median nerve and ulnar nerve and the radial nerve. Because of my case, that talk about that is that the radial nerve. Yeah, it's talk about the radial nerves. But the radius before that talk about is that the ulnar nerve, compressed from here. And of course, that the radial nerves, most of the common part, compressed part is on the head of the that ollobone, so that's the way from there. So that is most easy compressed part. And from ulnar nerves and compressed part always from here, most of the time from here. Okay, and the median nerves also come from here too. We'll talk about median nerve compression. Okay, here that I like maybe to play videos to show how do I treat the median nerve compression. And yeah.
Index finger, my thumb, and my middle finger. It's constant.
So how long has been like that?
About 4 years.
4 years. So haven't seen that the specialist or physiotherapist?
I've gone for massage therapy. I've seen a naturopath, neurologist, family doctor, chiropractor.
Everything. Okay, so what do they have find?
The chiropractor figures that maybe it's a compressed nerve.
Okay.
But I went for probably about 6 months and found no relief, so I just stopped going.
Okay. How about the neurologist say?
Neurologist first told me that it could be MS, and then walked out of the room and sent me for a CT scan of my brain and spine, and nothing showed up.
That's great.
Okay. It's good.
But right now that is still here.
Oh yeah, it's constant. Yeah.
Okay, so let me check out. Okay, that's good. Just relax. Just elbows, you know, and then just move your elbows and hands. Just any changes do you have right now?
It feels better.
This feels better? Yeah, not like before, like it's very,
Not-
very numb.
No, it feels better.
Feels better, right?
Yeah, so that's the the case that when we perform the medicine treatment, patient can tell you right away they're getting better. So and also treatment only take around maybe 3 to 5 minutes. Maybe you notice that I pay very that attention. Use my fingers to pipette to figure out where these kind of nodules or scar tissues around there, around elbow areas, and then try to use needles to break up those kind of scar tissues and nodules, and then release those kind of compression on that that median nerves. Okay, so next one I would like to talk about the prenatal tears syndrome, because this is very common. Why I want to introduce this the disease, because in clinic lots of patients come to your clinic talk about the carpal tunnel syndrome. So far in my clinic I found 90% that carpal tunnel syndrome actually they are the prenatal tears syndrome, not the carpal tunnels, because their nerve has been compressed not just from the wrist, actually from the elbow, from the prenatal tears, because here the median nerves pass, that the prenatal tears, it has 2 heads, then that the median nerve just pass through the both head. When this nerves get compressed, and then it will cause tingling and numbness on that, that median nerves. This is just like, that the sorry, not the word. Piriformis, muscles, the two, that the piece of the, that sciatic nerve pass that, that the piriformis muscle and cause the compression. This is exactly the same thing, that this causes from prenatal tear syndrome. Okay, so that prenatal tear syndrome is a series of symptoms that occur when the median nerve is compressed by the fibrous arch formed between the 2 heads of the prenatal tears muscle as it passes through the upper part of the forearm between the median epicondyle of the humerus and the radial head of the ulna. Okay, so the median nerve has no branches in the upper arm and pass through the space between the superficial and deep heads of the prenatal tears muscle at the elbow. In the forearm, it supplies the prenatal tears, the flexor carpi radialis, and the palmaris longus muscles. Okay, so that's the very very typical conditions. So for the manifestation and the diagnosis, when that happens, the patient, will tell you, that discomfort in the pain in the elbow and numbness in the thumb and index fingers, and sometimes relating to the 3 fingers on the radial side. But there are no symptoms of the night. The flexor muscle strength of the hand is weakened, and many weakness of finger flexor muscles in the palm. Okay, so when resisting wrist flexion, the hand tends to be deviate towards the ulnar side. So that because the nerve has been compressed. So for treatment, usually that we treat, that we have 3, targets, when A, B, C. So we treat this part, as long as we find the swollen, the tendon nodules around these areas. It's all our treatment the targets, and then to break those kind of nodules around these areas, and patients should be better right away. So here talk about the median nerve in the different locations, because of the nerve after the underneath of the elbow, the tear to the wrist, it could be few part compressed. For example, that when the prenatal tears muscle is compressed, the strength of the pronation of the forearm is normal, but pain is aggravated during the pronation and wrist flexion, friend, and like this. And of course, when there's a compression at the biceptor, of the neurosis, pain is aggravated during forearms supination, not pronation, supination, and elbow flexion. Okay. And when there's compression at the superficial flexor muscles of the fingers, flexing of the median finger can cause increased pain in the forearm. So the 3 part of the, that part could be compressed on the median nerve, but if you can remember, don't worry about that. You just follow that, that the median nerve will cause from elbow down the street, and then use a finger to pipette to see which muscle is tight, which part, that skin texture is getting harder or tender, that is treatment part. So maybe you don't have to remember, you just, that use a finger just sliding and then just pipette it, and then to find where, that is compressed part. Here that, I treat that, this kind of conditions.
Tingles and numbs on your hand and the fingers.
Morning, I feel some cold and my nerve can touch these 3 fingers.
The 3 fingers, yeah. Okay. I guess maybe your ear nerve has been, pinched as well. It feels tingles around here, right? This all part, right?
Yeah, that's the video talk about the ear nerve has been that compressed. So just like before the education videos, that talk about that cubital, that the Tanner syndrome. Okay. But also he has that that the radial nerve compressed too.
Right?
Yeah, just sliding, on the skin, find, any abnormal high tension soft tissue or any nodules or scar tissues, and then you just perform the treatment. You don't have to go to very deep. As long as your needles, pass through the nodules, and the patient should be better.
Is that all right?
Yeah.
See? After that, and the patient will feel better right away. Okay, so that the radial, the Tanner syndrome, that same as that the cubital, that the Tanner syndrome. I don't have to talk about anymore, because that I think it's just right. Okay, so that is kind of way that this doctor uses a hand massage and then just try to push back that the adhesion tissues from the sciatic nerve part. So it just maybe imagination that how could it be? It's easy to do that or difficult to do that, because that the piriformis muscles underneath of that that the glue maximum, glue medium, and then very deep. And then when you do the massage and then try to push, that back and separate, the adhesion tissue from the nerves and the muscles, it is not easy things. I think that with maybe millimeters, and then we can, find the nodules there, adhesion tissues, and then very easy, to break up those kind of scar tissues and then release those kind of adhesion. So it should be much easier. So let me see that this, I treat this patient, that for sciatic nerve pain.
Okay.
I'm okay.
Okay, so that that you have some sciatic nerve pain.
Yeah.
How long has it been?
It's since 2004. I fell.
You fell, okay. And then right now, most of the pain you're on the left side,
On the
right?
left side. Right now I'm numb.
Right now, you feel numb on your left side.
And tingling. Like
tingling to you?
Tingling and numbness. Like
Okay, and also right now that you have pain on the side.
on
too.
the left side.
Yeah, so typically when you back,
Yes.
yeah,
Moving forward, I could manage, but backward I can't.
you can, eh? And how about side to side?
On side, when I move this, I have numbness
Okay.
and tingling.
How about more on this side?
This one is not as much, but I could feel the pressure
Feel the
still
pressure there.
on the left side.
Okay, sure. Now today I give some treatment, that we call those, that mini Ren Acupuncture.
Okay.
We are directly, relieve the tension from the spine areas, and then after that we'll see what happens.
Okay.
Lots of issues here. See here.
even you don't tell me, I can find the problem right away. Yeah.
Because from that hour that the sliding or pipette.
Few steps to see how they feel.
A little bit tender.
It's much less now, right?
There's no pinching on that side.
Yeah.
Yes, pretty good.
So this is the way that that I say when patients lie on that on the bed properly, and then we use our fingers to pipette and sliding above the skin and soft tissues, we can find the tendon nodules, and then beside the spine, that the spinal process, that beside spine, and then we just use mini needles to back up those kind of small the nodules, and the patient should be better right away. Okay, so that's sciatic nerve, that entrapment, I guess make everybody know where is the sciatic nerve and where is the cause of the sciatic nerve, from that, there, and then, that down, to the legs, behind the knee, and then go to the leg, and then become that tibial nerves and fibular nerves, the different part. Okay, so I don't have to spend time on this part. So most common, that the compression side of sciatic nerve, usually have that one that is, of course, we will know that is kind of piriformis with muscle. I just like prenatal tears, the muscles, have two head, but this have the two part, that when nerve pass through that part, and then that compress on that that nerve. This is nerve. It's below that the piriformis muscles. Okay, and then that could be that that very easy to get compressed. And another part is that that the nerves between that the great trochanter, and also that from tingling that this muscle in shape with the sacrum as best that and this are located posterior the sciatic nerves that become diseased, and they can irritate the sciatic nerves. Okay, so that this is part could be that that irritated and then compressed. Let's learn that I maybe talk about a little bit about that the mini Ren acupuncture therapy for that merger, that Zetticar syndrome, that is kind of common in the clinic too. We call Chinese call that the white皮神经卡压. Okay, we'll see.
那他这个是骨外皮神经炎20几年了，今年第一次过来哈。那他的主要的症状呢，主要在大腿这地方 burning， 然后 itching and aching， 站的时间长了以后，然后呢，他到的那个疼痛症状呢，主要是用那个就是激素了，那个注射那个疗法，然后现在吃止痛药，然后今天我们先把这个治一治，好吧？主要在这边是找到他一个点，就是他这个筋。 他这边症状倒不是很明显，这边这一层。Relax, okay, man. Okay. Everything's okay?
Yeah, everything okay.
No pain, right?
No.
You just feel kind of a little
Just a little
bit ticklish.
little
Yeah.
pinch. That's
Little
it.
pinch, that's it.
That's
Yeah.
it. Yeah.
How do you feel now? Here, you will touch here. Do you feel anything?
It still feel numb though.
Yeah. But how's the burning sensation? Any burning sensations?
No.
No. Okay. So yeah, we're just working on the part so that it will take time and then slowly getting better. Okay. Yeah. Okay. Great. So that. From last treatment, I know that they have lots of burning, tingles, numbness.
So this patient come back after first treatment.
How do you feel?
After treatment, my swelling of my muscles have felt nice and calm. There's no knots anymore and no burning at all after the treatment.
So that you're very happy with that?
I'm really happy. Yeah, it really helps it for, you know, because the burning was very unbearable.
Yeah,
So it actually helps. I can stand for a long period of time and it doesn't burn anymore.
that's great.
Yeah.
That's
More right here.
more right here.
Yeah.
Okay.
You know, I find more burning on top than numbness on the side.
But right now, do you still have numbness there?
Yeah, still numbness on the side. But
Burning on top.
always
numbness.
burn on top if I burn at all.
Here is our treatment. Right. So this patient, after this condition has been years. Before the doctor gives that, injection, and the steroid injections. And then that at the beginning it works very well, but after that, it doesn't work at all. So and then she comes to my clinic for treatment.
Feels good.
That's good, eh?
Yeah, my muscles relax after the acupuncture. So last time I was here, the muscles were all tight. I get home, oh nice, relax. Okay, really good.
Yeah, that's good. Yeah, so that's the way that we have to use a mini-zinc acupuncture treatment to treat this kind of mergia parasitica syndrome. So this is kind of, common, conditions because of lateral farmer, cutaneous nerve from the L2 to L3 most often becomes injured by the entrapment or compression where it is pass, between the upper front, hip bone and the inguinum and the inguinal ligament near that attachment at the anterior superior iliac spine. We call that the ASIS, the upper point of the hip bone. So the nerve may become painful over a period of time as weight gain makes, underwear, building, or waistband or pants greatly exert high levels of pressure. The pain may be acute or radiate into the rib cage and into the groin, side, and knee. So ultimately, weight loss or aging may remove protective fat layers and the skin, so the nerve can be compressed against the underwear, alter clothing, or most commonly by belting. So long period of standing or leg exercise that increase tension on the inguinal ligament may also cause the pressure. So that that's the cause of the problems. So here that that is kind of way that compressed from this part. And the treatment, patients, usually we looking for those kind of areas. If that we find the nodules, and tender nodules around these areas, we give that treatment to release that kind of tender nodule and release the compression and pressure from here. And also patients, that just like the patient, he shows lots of burning sensations, tight muscles around this, bicep femoris muscles, from here. And then that we also get some treatment for that. And after treatment, he feels the muscle got relaxed, so that works very good for that. So treatment, that, I don't repeat it because generally that we work on these areas and also looking for that, that nodules around these areas. Okay, so that's very simple. Last one I talk about, the tarsal tenor syndrome. It is very common too. Okay, this is a case, patient was 65 years old female, was complained of the numbness and pain in both feet of the ear. The patient enjoys swimming and experienced numbness and pain in both feet, particularly that in the anterior 1/3 of the sole and the toes, with a burning sensation when walking barefoot by the pool. The symptoms have greatly worsened and are not affecting daily activities. The patient has sought treatment from the neurologist and physical therapist, but with no access. Examination revealed that no obvious abnormalities on the sole of feet, no redness of heat, but with clear tenderness and enlarged painful nodules above and below the medium malleolus. The diagnosis that we call that the tarsal tenor syndrome. But first and the second treatment involved acupuncture and herb medicine. That's what I did before the mini acupuncture treatment with local and distal acupuncture points. However, the effect was no significant. The patient still tell me, okay, same thing, that no differences with the regular acupuncture treatment. And from third treatment, it involves using the mini zinc acupuncture needles to directly release the enlarged painful nodules above and below the median malleolus. The patient felt 50% improvement at the time and was very happy. And with fourth and fifth treatment, and using the mini zinc acupuncture needles, the pain was completely disappeared. So he is very happy for that. So, okay, so that's that we talk about that cup tenders, that tarsal tendon syndrome. It is very common misdiagnosis and underdiagnosis in our clinic because lots of patients come to our clinic always complain that the heel pain or plantar fasciitis. Okay, so people just think about the problem from there, but actually I found most of patients because they are suffering from this kind of tarsal tendon syndrome. That is, if we use mini zinc acupuncture treatment, it works very good. We can avoid surgery, and also we can achieve the long-term result. Because when I treat this kind of syndromes, I not just treat that the tarsal tendon part. Also, I'm working on the calf muscles, to release the whole soft tissue, the tension above the legs, and then work on this part. We can achieve the long-term result. If just treat the local, the result just temporary. So tarsal tendon syndrome, that I don't want to spend more time, to talk about that, because I just say, in case in your clinic, if you find any patient suffering from heel pain, of course, could be that caused by that this bone spur or plantar fasciitis, and also you should be aware of it could be the tarsal tendon syndrome. Okay, so that you have to know how to treat it and where to treat it. And so that I think we can go through quickly. And so that's kind of treatment. So basically that, today I would like to give you my summary. That peripheral nerves entrapment syndrome is very common in a clinical condition for which effective treatment method are currently lacking. We don't have very effective methods to treat those kind of nerve entrapment syndrome with our regular conventional treatment. Okay, typically that with a regular acupuncture treatment, result is very limited, and most of the time patients complain doesn't work. So mini zinc acupuncture treatment, that it is very safe and effective method to treating, that to release those kind of scar adhesion tissues and then relieve, that tension on the nerve system, and it can achieve a quick result for that. And here that maybe I just introduce quickly that my online course for mini zinc acupuncture treatment. If you want to learn, I would like to give you some information about my course. I do have some kind of training, that in the past, that from 2018, 19, 20, and then in last year, also I trained some kind of physiotherapist, that for mini zinc acupuncture therapist, and seems to work so far so good. Everybody find it very helpful to treat lots of critical, that the pain or nerve entrapment, disease. And we have online calls. We have also in-person training, so that if that is interesting, maybe I just show quickly to show you. Let me see. Just give me a few minutes. Okay, that's all.
Sure, no problem. You just continue what you like, right? So your time still 2 minutes left. You can have more if you want. Sure.
Okay, come on. Okay. So maybe I can go to another one. That's fine. And then that here is my questions. You can let me know. And then that maybe just share screen again to see that where is my share for this part. Then that. Okay, so here that is kind of training that we have the training schedules, for this mini zinc acupuncture treatment. Yeah, this is kind of that in-person training that we are starting from the June and May and June and July, August. That also September, October. We have that. if you that one learn that from that my clinic, usually we take 3 person each time. So that's the way. And also we have, and okay, let me see. Yeah, we have the online course too, that, that we also teaching, that how, I mean, that from a very basic, that we can minimizing blood needles, superficial needling to break up the nodules, this kind of course, that we have, that the English version, that for English person, you want to learn the minimizing. And also I have a Chinese version, that to teach the minimizing acupuncture treatment too. Okay, so that's the things, that you have any questions, and then maybe we can discuss, that the questions, that you have. And yeah, so that that's all that today. That is my the presentation for minimizing acupuncture treatment for that nerve entrapment syndrome. Thank you, guys. Thanks for your time.
Okay, Dr. Huang, we do have a question from Michael.
Okay.
It says, could mini Ren acupuncture cut any nerve off by accident to cause permanent numbness? Does any patient?
Okay.
Oh, go ahead.
Okay, generally that we don't worry about that, because first of all that we are working exactly on the that scar and the nodules, and usually that the scar nodules just beside the nerve, not exactly on the nerve. Okay. In case, I mean that, okay, so nerve just underneath of that, of the scar tissue or nodules, because we know that the nerve, that fibers is very tough. Even that you use the scissors, you want to cut it, it's hard to cut it. Typically, when we learn that, anatomy lab in the university, we all see that any nerves, you want to use scissors to cut it, it's almost impossible. We have to use very, very sharp and very hard to cut it. So for this treatment, because we perform very gently, and then just when we, break up those kind of scar tissues, when we pass, that we feel empty and our fingertips. That means that, that already, pass through that. Sometimes patient will feel need to pinch the nerve, just like acupuncture, same. Pinch the nerve, patient feel tingling right away, and then it just stop it. You don't have to keep doing that. So don't worry about that. So far in my last 10 years, never happened, any injuries, any accident happens for the nerve injuries. Yeah, that never worry about that.
Okay, another question here from JJ. How do you insert the needle and how do you move the mini Ren acupuncture under the skin?
How to insert? Usually that first of all, I say we have to use our, that know where is compression site. And then that we just go there to the physical exam and then use our fingers, sliding on skin, and then we can feel, I mean, that the local areas that the skin texture become harder, maybe colder, and also if under fingertips, you can feel the nodules, underneath of the fingertips. And then you just use hand to hold it. And then that use needles just, beside your layer, go inside. And then once needle inside, you can hear the cutting sounds, like crunching sounds. And then that once pass through this part, and then no more sounds. If you're empty, that's it. And then that if you find another nodules around there, you can perform the same treatment. And then when patients, when you find the nodule disappeared, smaller or flattened, the treatment will be gone for this part. That's it.
Okay, thank you. Does anyone else? Oh, another question from Kim. It says, for the sciatic nerve impingement at the piriformis muscle, how do you release the deep muscle?
The deep muscles, that we have the way that from minimizing acupuncture treatment, we treat, origin and the insertion part of the piriformis. Okay, because below the piriformis, that the muscles are originated from the sacral, the bone beside there, and also insert through that great trochanter. So, of course, go deep We also can combine with the regular needles, for example, 2 inches, 3 inches needle, go deeper, and then directly to stimulate the spasm, the performance muscles. But from minimizing the needles, we can treat both insertion and origin part because they are very superficial, just beside the bone. And then from the bone edge, we find the nodules or the tension part of the muscle, and then we perform treatment. And then just to release the tension from the origin and the insertion part, and then that the whole muscle will get relaxed. Just like the patients, I treat, that after treatment, most of the patients told me after 24 hours, they feel 100% better. That even better than the time just to feel that after treatment, immediate result. Usually after 24 hours later, they feel that the result even better than the moment of the treatment.
Okay, any other questions?
That's the nodules. Please answer my second question. What's your second question?
His second question is, do the patients feel any pain or too much pain, which he or she may not tolerate when you use the 0.4 gauge mini Ren needles? Okay, so that, that I say, this needles, of course, a little bit, the size a little bit bigger than regular acupuncture needles. Okay, some patients, that, of course, from my patients, that I can tell, maybe 99% patients, they can tolerate this kind of pain. That's very just minimum. That as long as patients can take acupuncture treatment, usually they can take this kind of treatment. Because same thing. And also that you can use a tube, that just like that when I treat the patient with a tube, you can just just like our regular acupuncture needles, find the nodules and use tube, just tip it inside of the nodule. So, and then that pain should be very minimum, very minimum. So don't worry about that. But anyway, that I have tricky, for the pain, to distract the patients, that the pain sensation out of the body is that for treatment, I always give patients a candy. The candy, patients will say, why do you give me candy? I say, make you happy. And then that patients have the candy, and then we have a talk, and then when I give the treatment, of course, they still feel a little bit, that the impingement, but they are happy. I say, okay, let's make your pain become sweet. And then that you have a sweet pain. So patient generally, they take it. And actually we found when patients have a candy in the mouth, the pain, that the sharp pain sensation gets much less, feels more tolerable, the sensations. And also our treatment not very long. Usually we treat one part at a time for the body. For example, shoulder pain, elbow pain, the back pain. We don't treat all of them. We just treat maybe one part at a time, to a few points. So usually a few minutes will be done. So we don't have to, to perform 10, 20 minutes. And of course, and also after treatment, we give patients maybe 2 or 3 days rest. And then because after treatment, patients need time to rest, to rebalance, of that, strength, of the tension of the treatment areas. And then that should be getting better. Okay, so I think that's all the time we have. If you guys do have any other questions, please contact Dr. Huang, and I'm sure he'll be able to answer you. So just a reminder that after the next presentation, there will be some more presentations afterwards, so please don't log off. And then we will get on with the next presentation. Thank you so much, Dr. Huang.
So, and also remind everybody, open your window.
Yes, open your camera. Turn on cameras. I want to take a picture.
Everybody on face.
Yeah,
please. Open your window. Open your camera. Yeah. Everybody show.
Take picture.
Go up and we take a picture. And everybody wanted to get this to see you from Dr. Huang. Please sign your name. Okay. And I think this seminar is excellent. We just beginning, right? This is the kind of seminar is just beginning. In the future, we will continue to have more seminars from Dr. Huang and Dr. Wang and other speakers from our association. And we really open our association.